episode of PNB Show. Today we are going to talk about sickle cell disease, and my name is Samuel Ajin. Someone may ask, what is sickle cell disease? So it is a spectrum of diseases in which an individual inherits an abnormal hemoglobin gene, and this abnormal hemoglobin gene is known as hemoglobin S. So what is this hemoglobin I'm talking about? Hemoglobin is the red pigment that is found in our blood that helps our body to take oxygen and transport to other parts of our bodies. So if an individual inherits an abnormal hemoglobin gene, that causes the person to produce that particular kind of hemoglobin, which is hemoglobin S. That means the person has the sickle cell disease. So what is so special about this hemoglobin S that I'm talking about? First of all, the normal red blood cell is supposed to have a biconcave structure, which helps it to be able to pass through the smallest of blood vessels in your body. But then if you inherit this abnormal hemoglobin S, it causes your red blood cells to change the shape and assume the shape of a sickle. Now, if it assumes the shape of a sickle, then it becomes difficult for your red blood cells to meander through all the small blood vessels in your body. Sometimes they will get plugged and then they would obstruct the blood vessels, so you won't have blood going to certain parts of your body. So how is this particular disease inherited? First of all, we all know that we have our DNA, and our DNA is like the computer program in our system that codes for every single characteristic that we have: the color of our hair, the nature of our eyes, our height, and everything. So it is the same DNA that codes for our hemoglobin, which is this red pigment in our blood. And so if there's a mutation in the DNA, a particular part that causes us to produce our hemoglobin, and then that mutation causes us to produce this abnormal kind of red blood cell, which is the hemoglobin S. That is the way that we inherit it. And then we inherit it from our parents. So if we inherit one hemoglobin gene from each parent, so if my mom has the normal DNA for the normal hemoglobin, but then my dad has an abnormal, the normal is known as the A type, and then the abnormal is known as the S type. So if both of my parents should have the normal AA, that means that I would inherit the AA from my parents, right? But then if my mom or one of my parents should have one S, okay, there's a possibility that I'm going to inherit a hemoglobin S, right? And so if both of my parents also have S, they have at least one S in their gene, there's a possibility that me or any of my siblings can inherit both S's. So if I inherit both S from my mom and my dad, then I'm going to be a sickle cell patient. I'm going to have the sickle cell disease. However, if I inherit an A from my dad and an S from my mom, I'm going to be a sickle cell carrier. I would not necessarily show the signs and symptoms of the disease. Right? So what are the signs and symptoms of sickle cell disease? First of all, we know that our red blood cells have a lifespan. So our lifespan is about 120 days for normal red blood cells. So if I inherit this abnormal hemoglobin S, because of the constant changing of the shape into that sickle form, the red blood cells break down before the 120 days. So I'll become anemic. That means that I'll have a reduced amount of hemoglobin in my blood. And that would mean that I won't get enough oxygen to other parts of my body. So basically you have the signs of anemia in the person. They'll be tired easily, they would be having headaches, they'll feel dizzy, they'll be lethargic, and sometimes they can even have chest pain because of the reduced blood supply to their heart, right? Also, they will be showing signs like jaundice, and then their eyes will be pale and all that. But specifically for sickle cell disease, they can have a crisis, that is a state in which the red blood cells have changed into a sickle shape because they lack oxygen. When that happens, they will be having pains mostly in their joints, okay, and then that is known as a vaso-occlusive crisis. So they'll be having joint pains, bone pain. Sometimes even the red blood cells will block the blood supply to their bowels, that is their stomach, and then that can cause mesenteric ischemia, and that is very, very painful. Aside that, they can have accumulation of these red blood cells, these abnormal red blood cells, either in their spleen or in their liver. So that is what we call the acute sequestration crisis. So when it accumulates in the spleen and the liver, it causes pain as well in the abdomen. Right. Also, if the patient is a man, usually they can have priapism, that is prolonged erection for more than 4 hours, after which they can't have an erection again. They can lose the ability to have an erection. So mostly sickle cell patients in our setting, like in Africa or in Ghana, there are so many people affected by this disease. Most of these patients also are prone to infections, because as the spleen continues to accumulate these red blood cells, it also loses its own tissues. So the spleen undergoes what we call autosplenectomy. The spleen is sort of shrinking with time, especially if you have the hemoglobin SS. So these people don't have the spleen, which helps us to fight infections in our body. So they are mostly prone to getting infection like chest infections, abdominal infections, and all. Right. So mostly, how do we diagnose someone to have sickle cell disease? So we go to the lab and we do a sickling test, or we check the sickling status, which is going to show that this person has some of the hemoglobin S red blood cells in the blood. Or we will do what we call HB electrophoresis. This test is going to show us the percentage of the hemoglobin S that we have in our body, and then it's going to tell us whether we are SS or any other type of the hemoglobin sickle cell disease, right? And aside that, you can also do the normal blood study, the full blood count, to know the amount of red blood cells we have, the hemoglobin content, because as I said, because the lifespan is reduced, you usually have a reduced amount of hemoglobin in your body, right? So how do we treat patients who are having sickle cell disease? Mostly, if they are not under any severe condition, or they are not in the sickle cell crisis like I talked about, they will be given folic acid to take every day and penicillin to take every day as well, to prevent them from becoming anemic. And then they are advised to hydrate well, avoid strenuous exercises, because all of these things can put stress on the red blood cells to cause them to change their shape into that sickling form. And that is not what we want. Aside that, we can also give them chronic blood transfusion. That is that almost every month they come to the hospital and give them blood. Or we can also give them another type of drug known as hydroxyurea, which helps the body to produce the fetal kind of hemoglobin. Realize that the adult hemoglobin is different from the fetal hemoglobin, in a sense that there are some chains in the fetal one that does not exist in the adult type. So mostly, if a child is in the mother or in utero, you won't detect the sickle cell disease until the body starts to adopt the new or the adult type of the hemoglobin, which carries the disease. So we have a drug known as hydroxyurea that helps the body to produce the fetal hemoglobin whilst the person is an adult. And that fetal hemoglobin doesn't undergo the sickling like the abnormal adult one. Aside that, the only cure for sickle cell, which is not so common right now, is bone marrow transplant, and it's quite expensive, so we don't do it that much in our setting. So basically, that is it about sickle cell, everything from what it is to how it affects us, how we inherit it, and how it's being treated. Right, so let's talk about the most important part of this video, which is having sickle cell disease and how it affects our relationships, right? So say you and your partner, you need to know your sickling status. That's very, very important, because there's a higher chance that any of your kids could get the disease. So if I am AA and my partner is AS, that means that there's a possibility of me transferring one, or my partner transferring the S to any of the offsprings that we are going to have. But then that person is going to be a carrier, so that wouldn't be much of a problem. So it's good for people who are AA to marry AA to marry AS. But then if there's an AS marrying an AS, sometimes there's a higher chance that one or probably some of the children that you're going to produce would have the sickling defect as well. So it is advised that before you go into any serious relationship or you marry someone, you get to know the person's sickling status, because it is going to affect the kind of marriage that you're going to have. Because if your kids are all having the defect, that means you'll be spending a lot of money on drugs and going to the hospital. You spend a lot of time and all. It's going to put a lot of stress on the marriage and all. So it is advised that before you get married, you can check your sickling status and get to know if it is prudent for you to go ahead with a marriage. Right. However, it doesn't really stop you from getting married to the person that you want to, but then you just need to be prepared for it, because if it happens like that and then you don't have an idea, you don't even know how to prepare yourself to be able to take care of your kids and then your family and all that. So that is basically about the relationship, how it affects our relationship. Thank you so much for staying on this video. It's the PNV show, as you know. Make sure to like, leave your comments, and then most importantly, subscribe to our channel. Bye.